Welcome back, guys. This is part 2 of answering internet's most asked questions on knee injuries. Hi, I'm Dr. Sean Liu. I'm an orthopedic surgeon with a special interest in knee surgery and knee injuries. And welcome back. Right, let's bring back the box. Ooh, here it is. Right, let's begin. Is it true that orthopedic surgery is really loud and involves a lot of hammering, like in Grey's Anatomy? Well, I suppose there is a fair amount of hammering involved in certain operations like total knee replacements, but by and large, most of the surgeries that we do these days are not exactly very loud. They are minimally invasive surgeries involving using small little keyhole surgeries and portals that introduce cameras and small instruments into the knee. So basically, it is actually a very silent thing. And the loudest thing in the theatre is usually the music that we play to make everybody calm. Okay, on to the next one. Do you play music during your surgeries? Well, as a matter of fact, I do. So music is usually played because it has a calming effect on the patient when the patient comes into the operating theatre. Then usually I do play something like jazz or something which is nice and soothing, and that allows the patient to feel at ease. But during the surgery itself, when the patient is already asleep, I still do play music, and it helps me as well as my team to be able to keep track of time. So that's something that I personally do. Okay, on to the next question. What is the difference between a sprained knee and a torn ACL? Okay, so a sprain is a type of injury to the ligament, and of course the ACL is an anterior cruciate ligament. They are basically both injuries to ligaments, except that there are different grades of injuries. A torn ACL is basically the most severe type of ligament injury, where there is a total discontinuity of the ligament fibers itself. A sprain, on the other hand, is a less severe ligament injury, whereby the ligament is kind of pulled and there are micro tears or there are partial tears of the ligament. Right, next one. What are the symptoms of a torn meniscus? First of all, we need to understand what a meniscus is. Meniscus is a specialized tissue within your knee. It exists between two big bones, the bone on top called the femur and the bone below called the tibia. So its job basically is to allow the curved bone on top to meet the flat bone below with the most amount of surface area such that the pressure is spread out. When you have a torn meniscus, most of the time you do get pain. Pain because the meniscus may be unstable and it may be tugging along with the rest of the tissues around it, causing you to have discomfort. Or if the meniscus is really bad, the meniscus injury is really bad, you may actually have symptoms of knee locking. This is when the meniscus tissue comes out and blocks the two bones from moving. Right, on to the next one. What are the common causes of knee pain? Well, the common causes of knee pain that I normally see are due to injury as a result of athletic activities or an accident. It could be because of degenerative changes, like what most elderly people present to it, even without any injuries. Or it could also be inflammatory in nature, and the most common one would be gout. So those are some of the most common questions. Thank you for watching. I'm Dr. Sean Liu. See you again.